Types of mental health issues and illnesses. Mental illness is a broad phrase that refers to a variety of conditions that can cause symptoms that alter a person's thinking, perceptions, emotions, or behavior. Work, relationships, and other obligations can all be made more difficult by mental illness. The link between stress and mental disease is complicated. However, it is known that stress can exacerbate a mental illness episode. Medication, counseling, or both can help most people manage their mental illnesses. This article discusses some of the most frequent mental health problems and disorders. Number 1. Anxiety disorders. Anxiety disorders are a group of mental health disorders that includes generalized anxiety disorders, social phobias, specific phobias, for example, agoraphobia and claustrophobia, panic disorders, obsessive-compulsive disorder, OCD, post-traumatic stress disorder, PTSD. Untreated, anxiety disorders can lead to significant impairment on people's daily lives. Number 2. Behavioral and emotional disorders in children. Common behavior disorders in children include oppositional defiant disorder, ODD, conduct disorder, CD, attention deficit hyperactivity disorder, ADHD. Treatment for these mental health disorders can include therapy, education, and medication. Number 3. Bipolar affective disorder. Bipolar affective disorder, sometimes known as manic depression, is a form of mood illness. Mania, elation, and sadness are common symptoms of bipolar illness. The individual may or may not exhibit psychotic symptoms. Although the specific reason is uncertain, a hereditary tendency has been identified. Stressors in the environment might also precipitate bouts of severe mental disease. Number 4. Depression. Depression is a mood condition characterized by a poor mood, loss of interest and enjoyment, and a lack of energy. It is more than simply sadness. Number 5. Depression comes in various forms and symptoms. Depression has different degrees of intensity and symptoms. Depression symptoms might raise the likelihood of suicide thoughts or behaviors. Dissociation and dissociative disorders. Dissociation is a mental state in which a person becomes disconnected from their ideas, feelings, memories, or sense of self. Dissociative amnesia, depersonalization disorder, and dissociative identity disorder are examples of dissociative disorders. Number 6. Eating disorders. Anorexia, bulimia nervosa, and other binge eating disorders are examples of eating disorders. Eating disorders may affect people of all ages and genders, and the psychological and physical effects can be severe. Number 7. Obsessive-compulsive disorder. Anxiety disorders include obsessive-compulsive disorder, OCD. Obsessions are invasive and unwelcome recurring thoughts, visions, or urges. Compulsions are time-consuming and upsetting practices. Treatments include cognitive behavior therapy, CBT, and medications. Number 8. Paranoia. The unreasonable and persistent belief that individuals are out to get you is known as paranoia. Paranoia is a symptom of a variety of disorders, including paranoid personality disorder, delusional, paranoid, illness, and schizophrenia. Medication and psychological assistance are used to treat paranoia. Number 9. Post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, is a mental health illness that can occur in the aftermath of any stressful incident. An automobile or other major accident, physical or sexual assault, war-related events or torture, or natural catastrophes such as bushfires or floods are examples of such experiences. Number 10. Psychosis. Delusions, hallucinations, and muddled thinking are common symptoms of psychosis. Drug-induced psychosis, schizophrenia, and mood disorders are all examples of mental conditions that can cause psychosis. Psychotic symptoms can be alleviated or even eliminated with medication and psychological help. Number 11. Schizophrenia. Schizophrenia is a complicated psychotic condition marked by disturbances in thought and emotions as well as a skewed perspective of reality. Hallucinations, delusions, mental disorder, social disengagement, lack of desire, and poor thinking and memory are some of the symptoms of schizophrenia. Suicide is a major concern for those suffering with schizophrenia. Schizophrenia is not characterized by many personalities.